WFAA TV, Channel 8. This is Good Morning Texas.
And Craig Schwimmer from the Snoring Center will join us talking about sleep apnea. Yeah, it's not just a bunch of noise, it's actually a health risk. He's going to discuss what are the signs and who is most at risk. All right, wake up, guys.
Yeah, we'll try to stay awake during that segment.
All right.
That's a bad joke.
Yep, and plus do you have sleep apnea?
No, I don't.
Do you know what it is?
Yes.
Dr. Craig Schwimmer does, and he's going to let us know how to better understand this potentially deadly condition. All right, up next, Understanding Sleep Apnea. Dr. Craig Schwimmer begins a 3-part series on sleep apnea and what you can do if you have it. When we think of sleep apnea, most of us think of snoring, but in fact, sleep apnea can be much more serious. In fact, apnea is sometimes linked to high blood pressure, heart disease, and stroke. Dr. Craig Schwimmer, Medical Director of the Snoring Center, he is back this morning to begin his 3-part series on the dangers of sleep apnea. Hello, Craig. How are you?
Great. How are you?
So apnea, it's not just snoring. This could be a serious health problem. Define what is apnea.
Sleep apnea is a disease, and it's a serious medical condition, and it's characterized not only by loud habitual snoring, but repeated stop-breathing spells. And so people who have sleep apnea not only snore, and snoring is a hallmark of sleep apnea, but people who have apnea actually have repeated stop-breathing episodes during the course of the night.
Okay.
And so we've talked before about how snoring is caused by vibration of soft tissue in the back of the throat. In people who have sleep apnea, that tissue not only vibrates and makes noise, but it actually moves enough that it collapses the airway and prevents you from breathing.
Well, that's not good.
No, it's not. It's very dangerous.
Yeah.
And so what happens in people with sleep apnea is that repeatedly, over and over and over again during the course of the night, they go through cycles where they get into a deep stage of sleep, the tissue in the back of the throat starts vibrating, it actually collapses the airway and prevents you from breathing. And since you're not breathing, the oxygen level in your blood decreases to often dangerous levels. Your brain is always monitoring this, and your brain senses that there's less oxygen and that that's dangerous. And your brain corrects the situation by waking you up. So people with sleep apnea go through these cycles over and over and over again during the course of the night of falling asleep, blocking their airway, having decreased oxygen levels, and then these sudden awakenings.
We hope the sudden awakenings, right?
Yes.
This could be potentially deadly, this condition.
Yes, it's certainly associated with significant health risks. It's typically not the case that people stop breathing and don't wake up. Typically the risk of sleep apnea in terms of cardiac risk is more long-term because, as you can imagine, these repeated cycles of abrupt awakenings
and decreased oxygen
place a big strain on the heart and the lungs. And so certainly people with sleep apnea are at a much increased risk of heart attack and stroke and high blood pressure and a whole host of cardiovascular diseases.
So not everyone who snores suffers from apnea, but there are other signs like you discussed. Who is at most risk?
Well, you know, it's a disease that's prevalent enough that everybody really ought to think about it. Some estimates say that up to 5% of the adult population has sleep apnea. So clearly this is something that we all need to be aware of and thinking of. In terms of level of concern, is it likely that I have it or my husband or wife has it, things to look for are loud habitual snoring, gasping or choking sounds during the night, poor quality sleep. People with sleep apnea, because of these repeated arousals, which can happen literally hundreds of times a night, don't get normal sleep. They get poor quality sleep, and we've talked before about all the ill effects of sleep deprivation. So these people typically wake up in the morning more tired than when they went to bed. They have trouble concentrating during the day. Often they'll have headaches in the morning. So any of those things should lead someone to think, hey, maybe sleep apnea is at play here.
And then if you're in the high risk factor, if you're a male, right? And if
Absolutely.
you're between the ages of 40 and 60.
Absolutely. Men suffer more than women, and for the same reasons that we've talked about in the past, we tend to be more overweight, and obesity is certainly linked with sleep apnea. And also there are some anatomic differences. We tend to have shorter and thicker necks, and we have more soft tissue in the back of the throat. Similarly, people ages 40 to 60 suffer more, and that's also partly related to age-related changes in the tissue. It becomes floppier. We tend to be a little bit heavier as we get older, and we're more likely to be on medications which can relax those tissues.
Okay.
And then a third group that's at risk is African Americans. And interestingly, African Americans have an increased risk of sleep apnea. Now, some of that may be weight-related because there's an increased risk of obesity amongst African Americans, but some of that may be independent of body weight.
Okay. And so what kind of process do you go through to check if you have apnea? If you think you might suffer from these symptoms, once you come in and say, I need to be checked, what is that like? Well,
the whole process really should start at home. So if your spouse tells you that they're concerned, listen. Don't
say, no, I do not snore. Because sometimes people think, oh, I don't snore all the time. They're not aware that they're waking up and going back to sleep. So maybe denial is a #1 factor.
Denial is a huge issue here. So please, if your bed partner says, you know what, I'm worried, listen.
Okay.
And the first thing to do is to look at your sleep habits and think about how you feel in the morning and during the course of the day, and if any of these things really seem to be a factor for you. And if so, first thing, of course, talk to your doctor. And your doctor will probably talk to you about your sleep habits, get a sleep history, do a physical examination. And the only way to definitively diagnose sleep apnea and to know how severe it is with a sleep study.
Okay.
Now, traditionally, this has been done overnight in a sleep lab, but nowadays, for many patients, it can be done less expensively and more conveniently at home.
Okay. Excellent. I have to ask you, do you snore?
Occasionally.
Okay. I don't snore.
I know you don't.
I'm sticking to that. I really don't. I'm a very quiet sleeper. What are you going to talk about next week?
Next week, we're going to talk about what can we do about sleep apnea. Hopefully, people are aware that this is a significant health issue and an important disease. And over the last 5 years, some new treatment options have come around, and so we're going to talk about what can you do about it.
All right, that sounds good. Dr. Craig Schwimmer, thank you so much. We'll tune in next Tuesday for more on sleep apnea. And for more information, you can always log on to snoringcenter.com or call 214-369-2345.